How do you know if something is wrong with your bladder? What tips you off? Why would you even need to see a urologist? Well, I'm Dr. Rena, Malik, urologist and pelvic surgeon, and I'm going to explain exactly what signs you should look out for if you are worried that you might have a problem with your bladder. So the first symptom I would tell you to look out for is if you are having any sort of pain when you urinate, burning pain with urination, feeling kind of like pins and needles when you urinate, or anything where you're having pain in the lower part of your belly called the suprapubic area. That could be a sign that you might have a urinary tract infection. Also, if you have any urination that looks like it might be blood. If you have blood in your urine, that's definitely a sign that you should see a urologist because it might be a sign that you have a kidney stone, a tumor, or it could be nothing at all. But it's important to get it checked out to rule out any of those dangerous problems. Also, if you are urinating more often than you used to. So while you can urinate at different frequencies depending on what you drink or what you're eating, those can all affect urinary frequency. If you notice that you are constantly going to the bathroom despite changing what you might be drinking and limiting bladder irritants, and you can check out my video on bladder irritants to learn more about what those exactly are, then that's a sign that maybe there's something wrong with the function of your bladder. Also, if you are waking up more than one time a night if you're above 55 years of age, or even once if you are younger than 55 years of age, that may be a sign that you need to see a urologist. If you're drinking a lot of fluids before bed, it might be normal for you to wake up. So try limiting your fluids about 2 hours before bedtime to see if that helps with your nighttime wake-ups. If you find that you are having trouble emptying your bladder, like straining a lot to empty, spending a lot of time on the toilet, waiting for your stream to start, or kind of just feeling like you're not empty when you're all done, that's definitely a sign that you should see a urologist to find out exactly why you're having so much difficulty emptying your bladder. One, because not being able to empty your bladder puts you at risk for recurrent urinary tract infections. And in very severe cases, can cause damage to the kidneys if that urine backs up into the kidneys. So I want you guys to rest assured that a lot of these things are not life-threatening and not dangerous, but they can be a true, huge impact on your quality of life. I see patients all the time who tell me they can't even go see a movie because they have to go to the bathroom so much, or they can't leave their house, or they need to know where the bathroom is at all times. In fact, I just saw a study that looked at the impact on quality of life. The two biggest coping strategies that people found that when they went outside, they always had to know where the nearest restroom was, or two, they needed to have an escape route if they had an accident. That's a horrible way to live. So please put yourself first. Always remember to take care of yourself because you're worth it.